Hi, my name is Candace and I'm the treatment coordinator here in this office. And I just want to say welcome to Advanced Orthodontics. We're so excited that you've decided to join our ortho family. And I just wanted to review a couple details before you come in for your Invisalign bonding appointment. Okay, so first, just a couple of the highlights about Invisalign. We've most likely discussed this when you came in for your exam appointment. So with Invisalign, you're generally going to wear it 22 hours a day. You're only going to take it out to eat, drink, and to clean your teeth. When you're cleaning, you're generally just going to do a full cleaning of both your teeth and your aligners in the morning and the evening. When you're done brushing your teeth, you can just simply use leftover foam on your toothbrush and brush inside your aligners. And you just floss once a day, whatever time you prefer. The rest of the time when you remove them, you're just gonna rinse them out with just water, both your aligners and your teeth. You don't have to do a full cleaning every time. And then you'll just go ahead and you'll just put them back in and just continue to wear them. A couple things to keep in mind is to take good care of your aligners. One is you want to be mindful if you have any pets or animals at home, they love to eat your aligners, your retainer. So what we just ask is that whenever we have a saying here, whenever it's not in your face, it's in your case. So just make sure that you're putting it in your retainer case, not in paper towels, not in your pocket, not in your lunch tray or your lunch boxes, but back in the case. And then if you do have pets to consider, you want to put it either up high or in a drawer where they're not able to get a hold of it. You've probably already been told this before, but every once in a while we do have patients that maybe didn't quite understand that we will actually be bonding two colored attachments to your teeth. So instead of placing metal brackets, what it is it's just like a little tooth colored attachment. It blends in with the color of your teeth. It's just kind of like a little bump on your tooth. They come in different shapes and sizes, and we do bond those to your teeth. You'll want to plan on having them on most, if not every single tooth. You may not, but it's always better to have that expectation ahead of time. Basically what we'll do is you'll have a box, an Invisalign box. Sometimes you'll have several that you'll take home with you. We usually give you all of your aligners up front, and then you'll move through them generally every 7 days or so at home. So what will happen is you'll get a pouch that will look like this, and they're numbered. And so you'll have one of, maybe you have 20 aligners. It'd be 1 of 20, 2 of 20, and so on. And then for both the upper and the lower aligners, you'll have a number on it. So on the upper, in the back corner, it's going to say U and then a number. So if it was U1, that means it's upper tray number 1. And usually if you put it against something white, you'll be able to see that number a lot more clearly. And then on the lower, it'll be the same thing, but it'll say L1 for lower tray number 1. So just in case you ever get confused trying to remember which number aligner you're on, that's just kind of a quick way to be able to tell. So you'll just kind of move through the aligners at home every 7 days. A couple things that are very important is before you move into your next aligner, you do want to visually check your current aligners and make sure that you don't see any gapping or fit issues. If you do, we will give you what we call an aligner chewy, and you'll just bite against that and you just keep it in your case, and you would just really work that chewy until you got to see all the way down, and then you could move forward into your next tray as normal. Not only are we going to give you your box of aligners, but you'll also get a box that will contain both a retainer case, and again, if it's not in your face, it's in the case. And this is what it will look like. And then you will also get what we call cleaning crystals. And basically these are great that you can go ahead and just drop your aligners in them and you can soak them. Generally, you're switching your aligners every 7 days, so most patients don't find that they feel the aligners get dingy enough to have to use their cleaning crystals right away, but they do come in really handy when we're scanning for refinements and you're holding an elastomer as a nighttime retainer until your refinement trays come in. And so I'll explain what refinements mean in just a moment, but these can be great for that. So when you starting Invisalign, your initial Invisalign bond appointment, you're going to have so many aligners. So in this example, if you have 20 aligners, that would be about 5 months worth of active treatment. When you reach the end to your last aligner, number 20, then what you would do is you would hold in that aligner as a nighttime retainer, generally after dinner throughout the night. And we would update your scan to order an additional set of aligners, and we call those refinements. It usually takes us about 3 to 4 weeks to get a refinement back. And during that time, you'll just make sure it's very important to keep wearing those at night. We don't want your teeth to move from the position that we scanned them in. We want everything to stay the same. So you just wear that as a nighttime retainer. You can use your cleaning crystals because during that time you might feel like you want to freshen them up a little bit. Okay, so we have some frequently asked questions, and a few of those would be, what do we do if we lose our aligner? And so that's a great question, and we actually have a really easy answer to that. Most of the time, if your dog happens to get a hold of it, if you happen to lose it, or sometimes an aligner might crack or break before you've been able to complete the full 7 days. And if this happens every once in a while, generally it's not a big deal at all. What we just do is we have you skip ahead to the next aligner and just wear that extra days. So maybe instead of 7 days, you would wear it 10 days. The only time that we might run into a little issue is if we're having this happen consistently or back to back, then sometimes we can start to get a little bit of a fit issue. And if that happens, then we will go ahead and talk to you about that at that time and give you some instructions on how to help correct that. Another question that we get is, what do I do if an attachment comes off? So most of the time with Invisalign, if you have an attachment come loose, what's really great about Invisalign is you can still be progressing through treatment even if an attachment comes loose. So as long as your trays are fitting really well and they're tracking, all your teeth are tracking, then you're still progressing in treatment. It doesn't mean we won't want to rebond that attachment, but it's not urgent. You're not having to schedule to come in right away. It's still good to maybe give us a call and let us know. We'll mark it in your chart, and then we might plan on just rebonding that at your next appointment. And then the other question is do I have to be careful, or there are certain foods that I can't eat? And generally with Invisalign, we don't really have very many food restrictions. With Invisalign, you don't have very many unexpected visits, and you could eat most of your normal foods within reason, like no chewing on ice or Jolly Ranchers or things that are really hard. But generally, you can still eat all of your normal foods. Okay, so that kind of concludes what to expect at your Invisalign bond appointment. If you have any questions, then just please feel free to reach out to us. You can, ask us when you come in to get your Invisalign bonded. You can also reach out to us by email, text, or by phone, and we'd be happy to answer any questions that you have. We hope that this might answer any questions that you have ahead of time. And again, when you come in, your clinician should be able to walk you through all of this and answer any remaining questions that you might have. We're so excited for you to join our office, our practice. So welcome to Advanced Orthodontics.